Well, hello everyone, and welcome to Gilda's Club Quad Cities 2021 Shine a Light event. I'm Kelly Kraft, Program Manager at Gilda's Club Quad Cities, and today we're just going to learn a little bit about lung cancer. So today I'm going to go over a little bit about Shine a Light and the GO2 Foundation, Gilda's Club Quad Cities, and then we're going to talk about lung cancer. So we'll talk about some of the causes and risk factors, diagnosis, treatment, prevention, and then we'll give a little thanks to the sponsors that made this possible. So just a little about Shine a Light. It's the largest coordinated awareness event for lung cancer, and that's what this is. They look different all over the country. There are some that are in person. This one is a Facebook Live, and there are about 200 of these events going on throughout the month, all over the country. And so a little bit more is just about connecting, educating, and providing hope. I love this picture. Last year during 2020 and COVID, they did Shine a Light in a parking lot because COVID wasn't going to stop them. And a little bit about the GO2 Foundation. Again, just like Shine a Light, it's really about supporting people who are at risk and diagnosed with lung cancer. And they support those people with patient-driven research, support services, and community engagement. They provided us with a bunch of educational materials regarding lung cancer. Here are a lot of brochures that they sent us, and we have those available at our Gilda's Club Quad Cities Molding Clubhouse. So feel free to stop by if any of these interest you, and we can get you a copy. So their little call to action, we're posting this with the hashtag ShineLight21. And they also have a couple of things you can join in on if you are interested. So just a little bit about Gilda's Club Quad Cities. So we are a cancer support community that provides 100% free psychosocial support to anyone impacted by cancer. So that's a person with an active diagnosis, that's survivors, that's the adult friends and family, and the kids and teens. So everything we do is free, and we provide support with support groups, educational workshops, healthy lifestyle activities like yoga and meditation. We also have kids and teens programming, social events, and we're also a hub for resources and referrals. So we're just going to talk about lung cancer for a little bit. Obviously, lung cancer is cancer that starts in the lung. It can go to other places in the body, but if it originates in the lung, it's typically lung cancer. And there are two types, small cell and non-small cell, which is more common than the small cell type. The treatment are a little different between those two types. And everyone out there in Facebook land or watching this on YouTube later, just try to think, what do we think the leading cause of lung cancer is? And I think most of us know it's smoking. It's a link to 80 to 90% of lung cancer deaths. And just a couple of things about tobacco on here. One of the biggest things that I want to point out on this slide is quitting smoking at any age can lower your risk of getting lung cancer. So whether you are 16, 18, 50, 70, 90, quitting at any age can help lower your risk of getting lung cancer. And cigarette smoking can also cause cancer in other places than just the lung, so mouth, throat, stomach, esophagus, etc. I want to talk a little bit about teen smoking and lung cancer. So every day, almost 2,500 children under the age of 18 try their first cigarette. And more than 400 of them will become new regular daily smokers. And half of them will ultimately die from their habit. I know this is a little bit of scared straight here, but by this math, if somebody tries their first cigarette before they're 18, they have an 8% chance of dying from smoking. That's just using the math from that statistic above. It's really just reminding anyone with, if there are teens watching this or parents with teens in the house, to help them be able to say no to trying those first cigarettes. And this last piece here, among adults who have ever smoked daily, 87% tried their first cigarette by the time they were 18 and 95% by the age of 21. So it's getting through some of those formative years, the early years, the peer pressure. It's hard in this. I know it's a little scared straight here, but if you can help your kid not start, that's one of the best things that we can do. So here's some other risk factors for lung cancer, because as much as smoking is number one, there are other things that can heighten our risk factor too. So secondhand smoke. So 1 out of 4 people who don't smoke are exposed to secondhand cigarette smoke. And radon is a really big one. We'll talk about that in a little bit here. Any personal or family history of lung cancer, and also our diet and the, other behavioral factors. So personal and family history of lung cancer, that one's really important to make sure that your doctor knows about those things. So really when you go to a new doctor, they're going to ask about a lot of this, but making sure that if there is a personal or family history of really any type of cancer, that your doctor knows about that. So let's talk about radon. So radon is the second leading cause of lung cancer, and it's really hard to know if it's around us. It's a colorless, odorless, radioactive gas. Most of our exposure to it is in houses and buildings that happen to be higher in radon. So the best way to lower your exposure to radon is to know that it's there. So you can get an at-home radon test kit at any hardware home supply store. There are a bunch of them in the Quad Cities. They're not super expensive. And if your home does have too much radon, there are a lot of things you can do to make your home safer. There are radon mitigation systems. I thought they were super expensive, but they are not all that expensive to get installed. And it's definitely worth it for your health. And I want to talk about vaping a bit here, because vaping is being marketed as a safe alternative to smoking, and it's not safe. It's still an addictive drug. They're still figuring a lot of it out, but even vapes have been known to have cancer-causing ingredients. And it really comes down to the fact that there's a lack of knowledge and honesty and regulation of the ingredients. The FDA doesn't do a whole lot when it comes to vaping, so they can kind of put whatever they want on the labels, and that's not necessarily what's in them. So how is lung cancer diagnosed? So if somebody is having some symptoms of lung cancer, goes to the doctor and that is a concern, the doctor's first going to do a physical exam and get any history. Again, that family history would be an important piece here. They would probably do some lab tests, some scans. They may study the fluid in and around the lungs, and if necessary, a biopsy. And here are the stages of lung cancer. So stage 0 is just abnormal cells, not necessarily cancer yet, but it may become cancer. Stage 1 is a small tumor. Stage 2 is local spread or a large tumor. Stage 3 is if the cancer spread to lymph nodes or farther out into the chest or abdomen. And stage 4 is that cancer is spread to organs not near the lung. Such as when somebody gets diagnosed with lung cancer, when they get the staging, it gives them an idea of kind of how far that cancer is spread. And let's talk a little bit about different treatments for lung cancer. It's pretty much the same as what we see with other cancers. So one option is surgery. You can cut out the cancerous tissue in the lung. We can remove part of a lung or an entire lung. And sometimes surgery is combined with other types of treatments, like radiation, which is using high energy rays to kill the cancer. Usually it's external radiation. It can be used alone, before surgery, or after surgery. I like to talk about the side effects of treatments, mostly so that people going into treatments like this can have an idea of what they might face. And also it helps those of us who may care for or love somebody with a diagnosis know what they might be going through. So some side effects of radiation, the most common one that we hear is fatigue, really severe fatigue. But it can also cause kind of skin burn, so what seem like almost look like a sunburn depending on the person, sore throat, and cough. And chemotherapy is another really common treatment for lung cancer. So it's using those chemicals to kill the cancer cells. It can be given a few different ways. Some people take chemotherapy by a pill. Some people have it in their vein, like with an IV or a PICC line, and some people get a port put in. And this picture to the right is kind of what a port is. It goes underneath somebody's skin, it goes right into their vein so that the person doesn't have to get poked over and over to get an IV or an IV in. They just kind of go right into that port, and it's really easy on the person. It's a quick surgery that somebody gets before they're about to start treatment. And then once they're done with all of their chemo, they can have that small surgery and get that taken out. And it can be a really big quality of life helper when somebody is getting a lot of chemo. So chemotherapy targets fast growing cells. That's how it knows to kill the cancer. So that includes cancer, of course, but it also targets our healthy fast growing cells. So our hair, our healthy fast growing cells, our mouth cells, and skin cells. And that's where those common chemotherapy side effects come from, is the chemotherapy affecting those fast growing cells without knowing the difference between fast growing cancer cells and fast growing healthy cells. So if the chemotherapy is affecting somebody's hair, they may have hair loss, which is a very common chemotherapy side effect. They may have mouth sores or rashes and other skin issues, and also that nausea and vomiting that we see a lot with chemotherapy. And I want to just talk about reducing our risk factors for getting lung cancer. So number one is not smoking or attempting to quit smoking if you smoke now. Same with vaping and avoiding secondhand smoke, the best that we can. Get your home tested for radon. You never know. You can't see it. You can't smell it. It may be there. The best thing you can do with that is just know whether it's there so that if it is, you can do something about it. And then just know your surroundings and what you put into your body and your lungs. If you or someone that you know is thinking about quitting smoking, it can be a very nerve-wracking thing, and it takes a lot of work. Here are some resources for them. So for our teens out there that may be needing to quit smoking, there's teen.smokefree.gov. I love this site because it has, you can text it, you don't necessarily have to call somebody. But for anybody who wants to call, there's 1-800-QUIT-NOW. I have a Spanish phone number there for you. And then there are some Iowa and Illinois specific sites as well. And lastly, I want to talk about the stigma that comes with lung cancer. So we know that smoking really ramps up our risk factor for lung cancer, but that doesn't mean that somebody who smoked deserves to have lung cancer. There's a lot of stigma when it comes to lung cancer. People think that somebody deserved it or, did something to cause that lung cancer. And it may have, maybe the person smoked for a while in their life. That doesn't mean that they deserve lung cancer. It doesn't mean that they don't deserve empathy, help, and love. Lots of people who get lung cancer never smoked or quit years and years and years ago. And even if somebody did actively smoke and got lung cancer, nobody who smokes deserves to get lung cancer. And so it's something that we all have to kind of work on to reduce that stigma, because people with lung cancer absolutely do deserve empathy, help, and love. And we need to remember that when somebody gets diagnosed. Here are just some resources where I put this, where I got my information for this program. And lastly, we want to acknowledge the support of Shine a Light national sponsors. So close up on that for a bit. And lastly, thank you so much for joining me. Here's a little more information on Shine a Light and GoTo Foundation. If you need anything from Gilda's Club, we're at gildasclubqc.org, or you can give us a call, 563-326-7504. Thank you so much for joining me, and hopefully I'll see you all soon.